Welcome to UNC. The purpose of this video is to give you a sense of the broad clinical experience you'll get while training at UNC. You'll finish up your residency ready and prepared to practice as a generalist or to enter your subspecialty fellowship training of choice. You will be poised to be a leader in our field as a compassionate, patient-centered, evidence-based clinician. So give us a good look. We are so excited to meet you.
Welcome to Chapel Hill, UNC ObGyn. I'm so happy to actually welcome you to our wonderful department where we have 10 incredible divisions that are well balanced with outstanding leaders both in clinical education as well as research spheres.
On the benign gynecology rotation, our chief, second year, and intern resident teams spend a lot of time in the OR performing a wide variety of major and minor procedures with the advantage of working with both the specialist and minimally invasive divisions. During the second year, there's scheduled and supervised time for FLS and robotic simulation training, as well as experience in dedicated pelvic pain clinic with our pelvic pain specialists.
For me, I was really lucky enough to have exposure to urogynecology as my first rotation in second year. I do think it is something that I'm going to end up pursuing as a fellowship option down the line, and I don't think that I would have been able to feel comfortable in that decision had I not had the opportunity to work with those faculty, those patients very early on.
So the best thing about UNC, I love clinic, I must say. And the reason why is because you have a lot of autonomy with your patients in clinic. Like right in the door, we're started to take care of patients on our own, and we're really we see ourselves as their doctors.
Not only do we see it in our continuity clinics, we go above and beyond, I think, to make sure that the women we take care of, the patients that we take care of, have access to the things that they need, whether it's, putting in some extra time after clinic to fill out some extra paperwork or giving them a few extra calls. I see my colleagues, my co-residents, the faculty that we work with doing that for patients. So it's really amazing to know that I'm in a space where that is supported. Similarly, when we work out at WakeMed in Raleigh, we take care of women who have very little access to care at a very nice private hospital. And so I see it kind of at all levels where people want to give patients access to very high quality care.
So our second year rotation in complex family planning provides comprehensive training in all parts of reproductive health. You'll have the privilege of taking care of patients with early pregnancy loss, managing and developing comprehensive contraceptive plans for patients with medical comorbidities, and providing abortion care to patients with unplanned or medically complicated pregnancies. You will finish up our rotation where you get lots of one-on-one time with faculty and fellows, feeling really comfortable with your counseling and procedural skills. We work supportively with all of our learners to develop a plan that works well for you, so you will feel comfortable in this care.
So something that I knew I needed out of my training program was that I would come out feeling genuinely confident in my ability to provide comprehensive women's health care. And to me, that also meant that I would be able to provide abortions. And I wanted to be part of a program that was actively thinking about that and addressing that and asking really critical questions about what it looks like to support women and other folks who need comprehensive reproductive health care at a time where access to those services is becoming more and more limited and more politicized.
It's always a privilege to be able to provide those services to patients, to be able to counsel them through this very, very tremendous moment in their life that can be very life-changing. And I take that as a very, very massive privilege to be able to provide those services to patients and be with them through that time of their life. By the time I graduate, I will feel very, very comfortable providing those services as an independent ObGyn if I choose to become a generalist.
As a resident, we rotate with the REI department, or the Reproductive Endocrinology and Infertility department, as an intern and as a chief. As an intern, it's really great to start off your residency experience with the REI division because you're learning about the intricacies of the menstrual cycle and the HPO axis on such a basic and cellular level that it really provides a great foundation for the rest of your residency training. In addition, you start learning how how to do transvaginal ultrasound. So initially it can be very disorienting, how to perform transvaginal ultrasound and how to figure out what you're looking at on the screen and how that relates to the patient's anatomy. But you have fellows and attendings that are right there with you in the room that are helping orient you and guide you throughout that. When you're in the OR with the REI division, you're assisting with diagnostic and operative hysteroscopy, as well as some operative and diagnostic laparoscopy. So our REI exposure is really wonderful, and I love how we get it in the beginning of our residency training and then to kind of top it all off as a chief.
REI was the first rotation that I did as an intern, and honestly, at first I was really nervous to start on it because I came from a medical school where I really didn't get any experience in REI at all. I was nervous to be in this new realm that I'd never experienced before, but everyone was so welcoming to me when I first walked in. Everyone made me feel comfortable. Everyone was really supportive, and I felt like I got to learn so much, not just about REI, but a lot of the basics that you need to know as a generalist in OBGYN. I learned a lot about, the menstrual cycle and amenorrhea and PCOS, things that we see like every day, but also got to learn and appreciate a lot about kind of the intricacies of infertility and what REIs get to do on a day-to-day basis. And I really learned a lot about the process and developed a really big appreciation for that. I think REI was also a really special experience because you get a lot of hands-on experience in clinic doing transvaginal ultrasounds. You get a lot of hands-on experience in the OR, getting to learn how to do hysteroscopies. And it was really my first chance to kind of build on those skills. And those are skills that I feel I'll take with me, throughout the rest of residency and my career.
So yeah, I'm currently on my REI rotation and I'm really enjoying it. We get to go to UNC Fertility Clinic in Raleigh, and I get to work on my transvaginal ultrasound skills. I've done some saline ultrasounds, hysterosalpingograms, intrauterine inseminations, egg retrievals, and fresh embryo transfers, early OB ultrasounds, where you get to identify babies' heartbeats.
So the great thing about obstetrics at UNC is that really in the first year, you really sort of become an obstetrician to the point that you are managing interns at WakeMed in your second year with a lot of confidence and skill. You'd really be amazed at how much you learn just in that first year. And then you honestly act almost like a mini chief. And then in the third year, you are the OB chief. So you're a chief kind of a little bit getting your feet wet in your second year, a true chief in your third year, and then again at UNC, a chief in your fourth year. So definitely graduated autonomy, but in a way that pushes you to acquire skills quickly and competently. And I think that's something that's really special about obstetrics in our program.
We rotate at 2 different sites. We rotate at UNC and we rotate at one of the community hospitals, WakeMed. And it's great because there's completely different patient populations at each hospital. WakeMed is very high volume. You learn a lot of normal labor, more low-risk patients. And at UNC, we manage very high-risk patients with a lot of comorbidities. And we really learn how to handle like the maternal fetal medicine patients and patients with, on various medications, chronic diseases, and you really learn how to manage laboring patients during your first year.
OB at UNC is awesome. As an intern on my second day, I was able to get in the OR and do a C-section. We're delivering babies all the time. It's so great working with our attendings and the awesome nursing staff. You get really great support from your chief residents and your upper level residents who are just always there to help you out.
You're managing labor. At WakeMed, you learn how to do kind of the normal labor, which is really good to dip your toes into the water, but then you see the more high risk and scenarios at UNC, and you have some of most world-renowned MFM doctors there helping you, and the fellows are great and teaching all along the way, and it's a really great experience.
I have to say that I was one of those residents who was terrified to do gyn-onc, and that completely changed when I started working with our gyn-onc team. Our gyn-onc team is so smart, so competent, so skilled, and just really embraces every resident and really makes them part of the team. As an intern, you're on the floor managing the complex patients, and that's really where I felt like I started to gain some confidence as a doctor, because you are the intern, you are these people's doctor, and they're sick, they're complex patients, and it's where you're kind of starting to learn and think about these really complex medical conditions and how they affect someone in many, many different complex medical situations. As a third and fourth year, you're mostly in the operating room, and I have to say that our gynec division does an incredible job preparing you for the operating room. Their simulation for a hysterectomy is something that I use in every hysterectomy experience that I am ever in. It was incredible, designed by the amazing Dr. Meredith Newton. And anytime you are not in the OR as a third and fourth year, you are in the robot simulator, developing your skills, honing those surgical skills outside of the OR. There's so much support around developing you as a surgeon, even if gyn-onc is not what you want to do.
So I'm currently on the GYN oncology service, and it was a rotation that I was nervous about going into it because it's really complex patients, complex social situations, complex diseases. And I've really enjoyed it so far. I think that I've learned a lot medically about how to care for really sick patients, but also just the environment that you're in. You're surrounded by like world-renowned leaders in the field, which is something that's really special. And then the team that you're with.
So being an intern on the oncology service is a really scary experience at first, because you know that you're walking into a service where there are really sick patients and patients who are experiencing very life-changing diagnoses. And that's really scary. But at the same time, I feel like oncology as a service that allows you a lot of room to grow as a physician. I think that being on the oncology service is the first time that I've really felt like a doctor. You're making decisions that directly affect your patients. And as scary as that is, you're also on a service that is extremely supportive. I think one of the things that really stuck with me being on the oncology service so far is just how much you get to collaborate with every single person on that oncology floor, with the nurses, with the case managers, with the pharmacists, and you really get to feel what working in an interdisciplinary team is really like, and you get to feel that support and the encouragement from every single team member, and that's been something that has been really special to me.
I came to Carolina because of the prison, which always sounds like sort of a funny answer, but UNC has been providing care to the women who are incarcerated in our state prison system for decades. And I came here because that was a population that I cared about tremendously and wanted to be a part of it.
We were voted the best place to have a baby in Raleigh by the local newspaper and recently listed as one of the nation's best maternity care hospitals in Newsweek. We do over 3,000 deliveries a year with a 20% C-section rate. We do over 300 hysterectomies and over 1,500 GYN surgical procedures per year. ObGyn residents rotate at WakeMed twice each during their first, second, and third years. Altogether, residents spend almost a year total at WakeMed.
Come here day one, and as interns, you haven't been in an environment like this where people are looking to you for answers all of a sudden, and you're not able to look over your shoulder at someone else that's telling you the answer the whole time. And you know, we see a lot of patients here at WakeMed. The volume's really high, and so I think coming into it as an intern, it can be really intimidating. But one of the things that's really helpful with that is that you're with the same people. You know, the second years and the third years, and then your co-intern for the entirety of your rotation here. And it's a 7-week rotation. And so you really get to gel really closely with your teammates and work really closely with them, which is a great bonus of being here. That and the attendings here are absolutely incredible. A lot of them actually went to UNC, so it's really nice to have people around that are in an attending role but know exactly where you are and were you know, a few years ago.
WakeMed is a wonderful opportunity for the residents to practice many different aspects of ObGyn. The amount that you learn from your attendings alone and the relationships you get to build with them at WakeMed is probably one of my most favorite things about being at WakeMed as a UNC resident.
I applied during my intern year to the Global Health Research Fellowship. It's actually through the School of Medicine, and it's through cross residencies. So there's people in it from radiology, from pediatrics, and we had a chief who graduated last year who had done it, and then Caitlin Rittenhouse, one of our current chiefs, also is in it. And it's a 2-year fellowship, so you complete it during your second year and third year. It's funded, which is really nice. To be able to do some research, you find a research mentor and a project that I joined. So I am working with Dr. Benjamin Chi, who's in our division of global women's health, and kind of jumped on a couple different projects with him. And so I'm going to have my research funded, do most of it here, but it's all global health related, and then use my kind of elective month in my third year to actually travel to Zambia to do some of the research and then to implement it.
Regardless of your ultimate career path, whether it be academic, private practice, or fellowship, you will benefit by having a strong foundation in general OBGYN, and we hope to have a part in that.